Before I go into the different types of diabetes, I want to go over health promotion and disease prevention. For diabetes type 1, we can't prevent it. It's an autoimmune disorder, which I'll be going over later. However, it's really important that people with type 1 and type 2 diabetes have tight glycemic control. And what I mean by that is they take very good care of themselves so that their glucose level is in a normal range or an acceptable range for somebody with diabetes. So oftentimes they'll have to engage in lifestyle changes. For diabetes type 2, these lifestyle changes are the cornerstone of diabetic treatment. They need to lose weight, exercise, and diet, basically. And look in your textbook um, on the chapter of diabetes and ATI, and it's got a long list of interventions for health promotion and disease prevention. So make sure you understand them. All patients or all clients that have a BMI greater than 25 and above need to be screened. And this is for diabetes type 2 because we know that people with BMIs 25 or and above, that's one of the risk factors for having diabetes type 2. I mentioned previously that tight glycemic control is essential to prevent the occurrence of the long-term complications of diabetes. You can remember these long-term complications with the mnemonic KNIVES, okay? K stands for nephropathy, and that means kidney damage. So people that end up with chronic kidney disease, the two most prevalent diseases they have is diabetes and hypertension. It really puts a strain on the kidneys and they end up with chronic kidney disease. N is for neuromuscular conditions, neuropathy, which means they can't really feel things, right? Or they have pins and needles, so that's why they have to do things like check their water temperature before getting in the bathtub because they can't feel the heat, okay? I is for infective. So patients that don't have or don't maintain tight glycemic control are going to be very prone to getting infections such as UTIs, yeast infections, tuberculosis. So we want to keep tight glycemic control to prevent recurring affections, which are common in people with diabetes. Vascular, we want to prevent a cerebral vascular accident, which is also known as stroke, which is also the new term is brain attack. We want to prevent heart disease, and we want to prevent peripheral arterial disease. Okay, so in other words, we want to prevent the diseases of the vascular system that is going to lead to low perfusion in certain areas. People with diabetes can have silent MIs. An MI is a myocardial infarction, and what I mean by silent is they don't have the pain, the chest pain, because of neuropathy. And so they could have a heart attack and not even know it. When I worked in a pre-admission clinic, patients would come in to get their EKGs, and I'd see a Q wave, which is indicative of an MI. And you don't need to know that. I'm just telling you what would happen. And I'd say, when was your myocardial infarction? And they said they never had one. So that's just showing you that people can have silent MIs. E is for eyes, so they're going to be more prone to cataracts and retinopathy, which you learned in MedSurg 1. In the skin, they could get a lipohypertrophy, which means, or lipoatrophy, which means the fat can diminish in certain areas. And so to prevent that, they need to rotate insulin injection sites. So now we're going to review the different types of diabetes. So for diabetes type 1, which was previously known as juvenile diabetes because it happens more in young people, and also it was called insulin-dependent diabetes. However, we have found in recent years that patients with type 2 diabetes also need insulin. Therefore, now this name is diabetes type 1. Okay, it is characterized by being insulin dependent. You can't prevent it. It's always going to require exogenous insulin because their pancreas cannot manufacture insulin. They are going to be prone to ketosis. Ketosis occurs when our bodies are starving, and it's from the breakdown of fatty acids in the body. And so what's happening is because there's no insulin to help sugar get inside the cell to be used as energy, the body now has to break down fat for energy. So that's one of the signs and symptoms of diabetes type 1. Diabetes type 2, I had mentioned previously, we used to call this non-insulin dependent diabetes. However, in recent years, people with diabetes type 2 need insulin to control their blood sugar. And it's caused by insulin resistance. So the cells in the body are resistant to insulin. It usually occurs in people over 30 who are obese, who have metabolic syndrome, and I'll talk about metabolic syndrome pretty soon. Also, people that will be at risk for diabetes type 2 include people that had diabetes when they were pregnant. Also, people with a family history of diabetes. They're going to be more prone to hyperglycemic, hyperosmolar state, which we call HHS. And it's usually also caused by genetic and lifestyle factors. So the cornerstone of diabetes mellitus type 2 is going to be diet and exercise. Metabolic syndrome is a risk factor for type 2 diabetes, and the characteristics include a fasting blood sugar greater than 100, triglycerides greater than 150, HDL, which is the happy cholesterol that we want to be higher, not lower, is less than 40 for males and less than 50 for females. And you can drive that up with exercise. Also, having a blood pressure greater than 130 over 85 is a risk factor. And people that carry abdominal fat, so fat in their abdominal area, is called central obesity. So they will also be at risk for type 2 diabetes. Here are the signs and symptoms of diabetes. The 3 P's, so you're looking for polydipsia, meaning they're very thirsty, polyphagia, meaning they're very hungry, and polyuria, meaning they're going to have an increased urine output. So if there's high sugar in your blood, that means your blood is hyperosmolar, right? So that's going to bring more fluid into the vascular system, and it means that you're going to have increased fluid in your vascular system, so you're going to be putting out more urine. Recurrent infections, I talked about that earlier, so that you need to encourage tight glycemic control. Kussmaul respirations, this typically happens in type 1 diabetes when they get sick and their blood sugars get really high and they become acidotic. So it's a reaction to metabolic acidosis, and Kussmaul respirations, I don't know if you've had this before, are fast respirations. Okay, they're trying to blow off the PaCO2. And then, of course, headache and nausea and vomiting are also signs and symptoms of diabetes. The criteria to be diagnosed with diabetes includes having 2 of these findings on 2 different days. So 2 of the screening tests come back positive on 2 different days. So the first one is a hemoglobin A1C test greater than 6.5%. Now I need to explain what this test is. This test is a test that is used to determine if the patient had tight glycemic control over the last couple of months. So it is measuring the glucose on the hemoglobin in the red blood cell, right? So red blood cell lasts 120 days, so it makes sense that this is going to give the provider some insight into how well the patient maintained tight glycemic control over the last 3 months. Okay, 3 to 4 months, 120 days. Okay, so an A1C, also called a glycosited hemoglobin, greater than 6.5%. A fasting blood sugar greater than 126. Casual blood sugar greater than 200. Okay, so let me tell you what a casual blood sugar is. A casual blood sugar is, let's say, you go in for pre-op testing and they're going to draw your blood sugar. They're drawing your blood sugar without regards to you being fasted, waking up early in the morning. They're just doing a casual. They're taking a blood sugar at any time of the day. So if that is greater than 200, then you may have diabetes, okay? A 2-hour oral glucose tolerance test greater than 200. And if you've been pregnant before, you probably remember this test where you had to go and drink a solution. You had to be NPO before the test, and then they measured your glucose level throughout the test. So those are the criteria. Clients with diabetes are going to be prone to both hypoglycemia and hyperglycemia. So hypoglycemia is easily remembered by the mnemonic be tired. So these are the signs and symptoms you're going to see in your client. B stands for blurred vision. So when the blood sugar goes low, patients might complain of blurred vision. T is for tachycardia and palpitations. So when your blood sugar goes low, the sympathetic nervous system is activated. So that's why the patient's going to have tachycardia and palpitations. So that means they could have an irregular heartbeat. They're going to be tired and weak. I stands for irritability. If you know, like yourself, if you get hungry, you can get very hangry, right? And they could develop seizures. R is for restlessness and shakiness, which can also happen with hypoglycemia. E is for excessive hunger. Um, like that polyphagia we've talked about. And D is for diuresis, again, because the sympathetic nervous system is activated when your blood sugar goes low. And there's a phrase, cold and clammy, give me candy, okay, because you're going to have to give some sugar to somebody that's hypoglycemic, and we're going to go into more detail about that. Now, hyperglycemia can occur in diabetics if they become sick. If they have some illness, that's often an early sign as having a blood sugar that is high, despite having good glycemic control previously to that infection. Okay, so in other words, they're still doing all the right things, but now they have hyperglycemia. This can also help it. These signs and symptoms would also be prevalent in clients who have not been diagnosed with diabetes yet. Okay, so you can remember it by the mnemonic AWIPS. So the signs and symptoms include A for acetone breath. Okay, that's that fruity smelling breath that you might see in somebody that's a diabetic. W is for weakness. Their wind is going to be heavy, meaning they could have Kussmaul's respirations. Recall, those are those fast, deep respirations because the body goes into acidosis. So the body tries to get rid of the CO2 by breathing hard and fast. H is for headaches. I is for increased thirst. So there's that polydipsia. And P is for polyuria, polydipsia, and polyphagia that happens with diabetes. And S is for sight is blurry. So in hyper and hyperglycemia, they could have blurry vision. And look for other common signs and symptoms. Okay. And the saying that we say when somebody is hyperglycemic is dry and hot, give me an insulin shot. Okay, as promised, the treatment for hypoglycemia is to give forms of glucose. If your patient is awake, you're going to give forms of glucose orally, and if they are unresponsive, you're going to need to turn them on their side and give 1 milligram of glucagon followed by another dose in 10 minutes if the first dose does not work. Okay? You may also be giving D50 IV if they are unresponsive. Okay, so you're going to give 15 to 20 grams of glucose if your patient can swallow. And I have different suggestions of the type of food you can give. Remember that you never want to give diet soda. You want something with real sugar in it, okay? After you give some glucose, some form of glucose, You can recheck the glucose within 15 minutes. After you do that, then it's time to give longer acting glucose with protein. Like, for example, give them some cheese and crackers or give them a meat sandwich, okay? So you need something with protein to make the glucose last a little bit longer. Hyperglycemia is typically treated with regular insulin because it works quickly, like within 30 minutes. And when it comes to the IV form, only regular insulin can be administered IV. And that's going to become very important when we talk about the conditions such as DKA and HHS a little bit later on in this presentation.